Coolsculpting can be done in many areas of the body. It's mostly done in the trunk area, which includes the back. It can also be done on the inner thigh as well as the outer thigh. And our newest application is actually for the chin area, and I'll talk to you a little bit more about that in a minute. But this is one of the applicators. You can see that this is a big unit. This would be for somebody that is heavy set, and usually the most of their tissue, their fatty tissue, is below the belly button. This is a suction unit here, non-invasive, and you can see that there's two plates right through here. So you basically set this on the tummy, the fatty tissues non-invasively sucked into the unit, and then over the course of the next hours or so, the fat actually freezes. There's probably a 25 to 30% reduction in the fat over the course of the next couple months, and so it really takes time for improvement. We believe in regional treatments. So you might have Coolsculpting for, like a Coolmax here or a Coolmax here, and then come back in a month or two and then do regional treatments, which would be overlapping with a Cool Core. So those are smaller treatments overlapping through the same area. So you'll probably get more like a 50% improvement in fat reduction, or maybe even a 60% improvement with fat reduction. So each of these applicators has a little bit different shape, a little bit different size, so that we can customize it for each patient. So this is one of the early ones, which has been really great for larger. We have a Cool Core, which is for smaller areas. We have a Cool Fit that is actually on the inner thigh. And then we have a flat plate, which is the outer thigh. Our newest one is actually the Cool Mini. This is a neat one because an area that is really bothersome for patients is underneath the chin. So sometimes people think this is the chin area. In our practice, we think of this as a submentum. Either way, it's an area that has fatty tissue. This would be not a good applicator for people that have like loose skin, because this is a fat reduction machine. So you would only want to do this for people that don't need a neck lift or something like that. Because it's about a 30% improvement, and this is a lighter suction unit because there are some sensitive things here, you definitely need to have two treatments in the area that's underneath your chin. The applicator goes on kind of something like this, and then you have to sit stationary for about an hour or so. And I have to say, of all the treatments that we have, this one, you have to be a little patient while you're sitting there. You can't really like check your email, you can't watch a movie, you really kind of have to chill out and be stationary. So the other units, actually you can watch your email, look at a movie, you can take a nap, but this one's a little bit harder because of the immobility of it. It's a little easier to kind of knock off. So we're very excited to add the Cool Mini to our armamentarium. We've been really impressed with our Coolsculpting results. I would say we have about a 90 to 95% happiness factor for our patients, which is really hard sometimes to do. So when the concept of doing the Cool Mini came, we jumped on board, and we're in the process of doing many of our patients right now, and we're looking forward to some really good results.